Good evening and welcome to this episode of Tubules Live. Today we are fortunate enough to have with us Dr. AKIT Patel. So welcome to the show, AKIT.
Thank you for having
me. It's great
to
have you.
Thank you.
First of all, tell us a little bit about where you graduated from and how you got to where you are today.
I basically went to Guy's Hospital, did an undergraduate training there. And then I decided to go across the water to the dark side, to the Eastman Dental Institute, where I basically embarked on a four-year postodontic program. And then since then, been in primary practice, and I teach at the Eastman as well on their restorative program.
That's great. So today you're going to talk to us about how to make successful impressions. So what made you choose this topic?
Well, impression taking is easy, but to make really accurate impressions is much more difficult. And what you want is really, a highly accurate fitting restoration. So you kind of have to work backward and start from the beginning and see how we can get there.
That's great, and we look forward to hearing all about it. Cool. Before we begin, I'd just like to remind our viewers that CPD questions can be found on the right-hand side. And during the show, if you have any questions that you'd like to ask AKIT, please do put them in the box space below. So without further delay, I'd like to hand over the floor to AKIT.
Thank you. Good evening, everyone. Thank you for joining me this evening for the next hour to hear about how we're going to make successful impression in everyday practice. I'll do this by a presentation, and I'm sure you're all really tired, so don't worry, there's lots of photographs, lots of pickies, and a little live hands-on demo at the end. By the end, my aim is for you to come away with an increased knowledge and a wider set of skills so that you can perform this procedure more confidently in your practice. And for those who are new to Improgum, this will be an introduction on how it is best used. When we're looking at how good we are at making impressions, we need to look at the results. And for this, we have to go to the lab. And there are commonly 4 highlighted areas that keep cropping up by the labs. The first problem we've got here is that 50% of crown and bridge impressions made by the general dental practitioners are clinically unacceptable. In this study, they found that the tray design was the most significant factor because flexible plastic trays were used and sometimes they were even reused. The second big problem is that many of these errors are most evident at the restorative margin. This is usually due to inadequate gingival displacement. Donovan and Chu sums it up nicely to say that it is the proper manipulation of the impression materials that is the most important in determining the accuracy of the impression, rather than the type of material that is used. So basically, it's all about technique. So what are we trying to achieve to make this impression? We have to look at the definition, and it is a detailed representation of the soft and hard tissues, which basically forms an imprint, a negative mould of those tissues, and so that we can make a cast, a model of those tissues. So to get to the optimum impression, we need to capture everything above the margin, at the margin, and below the margin, and not forgetting the rest of the arch, so we can get the right occlusion. So the technician can relate the jaws together. Now there are various guidelines to help you to execute this procedure, and here is one that you can see on your screen. And we're very lucky because most materials manufactured by the top companies has spent a lot of money, in research and development, and they all pretty much work. They all do what it says on the box. So as Donovan has told us, it's not about the material really, it's about the technique. However, some materials can help us in certain scenarios. Right, so let's look what we need to change. So out of those variables, sorry guys, okay. So out of all these variables, 3 of them surface to be the most important in my eyes. One is the tray, so the tray itself, as in tray selection, ensuring the material adheres to the tray, so thinking about the actual adhesion of the material to the tray. Next, what we're actually going to put in the material, so the material itself, how it's mixed, how it's applied, the viscosity of the material. And thirdly, how the tray and the material contacts the mouth. Okay, so we've got the tray, what goes in the tray, and how the tray then touches the mouth. Okay, and how we're going to capture those margins without any faults. So what we need to do is start looking at these 3 elements. So this overview is hopefully going to provide you with a set of guidelines based on my experience. So what I've learned over the years, the good and the bad, and my aim is to improve your technique and for you to solve some of the problem areas that you may be faced with. And basically to make the whole procedure much more pleasant. Okay, impression taking is a pain. Yes, I find it really difficult, and so hopefully you can keep the patient happy, you're happy, and most important, your lab technician is happy. I'll be covering how to capture the margins, okay, the impression technique and the tray design, and how to use in-program material. What I will not be covering is digital impressioning. However, material and techniques for removable and implants, you know, are pretty much similar comparable to conventional